Hi, I'm Rachel.
This is Emily and this is Teal.
Today we'll be discussing topic 4,
Which outlines the physiological changes that occur postpartum.
Postpartum changes. It is important to recognise there are many changes within the female body that happen postpartum. Here we have listed the important changes the mother will experience physiologically. The topics in bold will be the topics we discuss and elaborate on during this presentation. Involution of the uterus, puerperium and the lochia, lactation and hormonal changes. Following on from the hormonal changes, we will also discuss postnatal depression. Involution is a primary change that happens within the woman postpartum. It is a retrogressive state in which the maternal reproductive organs revert to their pre-pregnancy state. The uterus returns to its original anatomical position. This takes place over 6 weeks, where the uterus goes through several transformations to complete the process. Immediately after birth, the uterine muscles contract in a beta-pleated sheet formation to constrict blood bleeding. During this process, the uterus is hard like a ball shape in the abdomen posterior to the umbilicus. When assessing the uterus at this stage of involution, it is crucial for the woman to empty her bladder completely. This is because a full bladder can deviate the position of the uterus, making the assessment incorrect. So in the pictures provided on the left-hand side, I have shown how the uterus will restrict and shrink over the several days. And on the right-hand side, I've got a picture of the fundus and a full bladder, and that shows a deviated and incorrect reading of where the fundus is positioned due to a full bladder. Using finger breadths to assess the position, the maternal nurse or midwife will assess the position of the fundus in relation to the umbilicus, assessing the shape, tone, and height. This is done to ensure the uterus is contracted and not filling with blood. The contraction of the uterus is caused by a release of oxytocin following birth. This can cause pain, which is called after pains. PRN analgesia is recommended and encouraged for the mother to utilize, as it can aid in relaxation to assist breastfeeding. Involution takes place during puerperium period. This is the first 6 weeks after birth of an infant. Other reproductive organs go through a similar process during this period. The cervix will never revert to its pre-pregnancy state, but it does go through several cyclical changes postpartum, where it slowly contracts, and by the end of the first week postpartum, a finger breadth will no longer be able to be introduced into it. The vagina is also an organ which will never regain its pre-pregnancy state. The ovaries return to a normal function, this is highly influenced on breastfeeding. This is due to the increased release of prolactin, suppressing ovulation. Following the contraction and repositioning of the uterus, a thick viscose discharge is expelled from the uterus via the vagina. This is called lochia. It is remaining placental wall. In the first 1 to 3 days postpartum, lochia usually presents frank in colour. This is called lochia rubra. Progressively, it lightens in colour by day 4 with a light red to brown colour called lochia serosa. Finally presenting light brown to clear, called lochia alba, which presents approximately day 11 to day 21. It is important to educate and provide information to the mother on this process and what to expect and what not to expect. So I've just shown in a picture there what a moderate, light and scant can look like, and a heavy saturation. And heavy saturation would be something of concern, and the mother would need the bleeding to be restricted. Encourage the mother to wear liners to provide hygienic care, and also ones that won't irritate the proliferating perineum. The perineum is usually retrogressive, the purpurium is mainly retrogressive state of the female body. There is one progressive state in which the female body initiates, and that is lactation.
After delivery of the baby, hormone levels fall and oxytocin is released, which quickly stimulates milk ducts to contract and deliver milk. Prolactin continues to rise when the baby suckles on the nipple for milk, and it stimulates nerves which continue the cycle for milk demand, therefore producing more. Mothers may experience physiological reactions such as breasts becoming warm, tender, hard and red due to decreasing of hormones from the placenta. Both prolactin and oxytocin help mother and baby form emotional bonds. Neuroendocrine mechanisms play a role in mother and baby bonding. The neural component includes nerves of the nipples stimulated by the baby suckling and plays a major role in emotional factors like the mother thinking of her baby or hearing her baby cry. The endocrine component refers to the hormones relating to the letdown reflex, which can also include if the mother hears another baby cry, her breast may leak milk. There are other signs that help the body maintain lactation. This includes smell. This helps the baby recognize its mum and assists in forming an emotional bond with the mother and social attachment. Changes in breast differ from one mother to another as it depends on whether they breastfeed or not. As mentioned prior, common breastfeeding sessions between mother and baby will sustain lactation. If the mother does not breastfeed or experiences difficulties, the milk will remain in the breast but cease within a week. Expressing milk is not encouraged if the mother no longer wants to continue breastfeeding, as it will initiate the cycle for the body to continue milk production. The maternal nurse will support the mother with whatever decision she makes regarding to breastfeed or not. The mother will attend antenatal appointments to follow up how mum and baby are progressing and to ensure the baby is hitting all normal milestones. There are many available resources for mums to reach out for guidance, advice or help, such as forums between other mums, their GP, a lactation nurse, or information at Australian Breastfeeding Association. A complication of breastfeeding is mastitis. It is usually the result of a blocked milk duct or milk status. This occurs when the milk becomes banked up and can be forced into surrounding tissue, causing inflammation. The mother should be educated on possible complications from the nurse whilst in the hospital and getting assistance to breastfeed if needed. Information on resources available, contacts and pamphlets should be sent home with the mum to be accessed if required. Mastitis can be caused by if the baby does not attach to the breast correctly, the baby is not draining the breast well, example if the baby is tongue-tied, an oversupply of milk or feeds are restricted. There are two types of mastitis, infective when infection is present and non-infective when it is not. Early symptoms include a tender hard lump on the breast, redness, intense pain to the breast, especially if the letdown reflex occurs, aches, tired and nausea, fever above 38.5 degrees. It is important the mother continues to breastfeed as continuous milk removal helps the symptoms subside. It is important to note the baby may become fussier with breastfeeding as the milk may taste saltier and take more effort for the baby to retrieve. Treatments can include ice packs post-breastfeeding to reduce inflammation. If the baby is not drinking from the breast, express to assist with healing. If flu-like symptoms begin, the mum needs to contact the GP and massage the breast as you breastfeed to reduce inflammation and assist with milk flow.
Postnatal depression affects 1 in 7 new mothers within Australia. However, many cases of postnatal depression remain undiagnosed due to social stigma. Studies in the US suggest that many postnatal depression cases remain undiagnosed because of multiple factors, including time restraint, mothers being perceived as unhappy, or worse still, feeling unsupported or accepted by family and friends. Approximately 80% of new mothers experience the common mood condition known as baby blues, which can strike at an early onset, peaking at day 4, and resolve by day 10 post-delivery. Whilst this condition is considered normal and common amongst first mothers, the baby blues can develop into full-blown postnatal depression if symptoms persist longer than 2 weeks. The key difference between the baby blues and postnatal depression is short time frame and the fact that the blues don't interfere with the mother's maternal abilities. There are multiple factors that potentially influence the onset of postnatal depression. However, one of the major reasons thought to be behind postnatal depression is a significant change in hormone levels after childbirth. Once the baby is delivered, the levels of estrogen and progesterone dramatically decrease within the woman's body. This sudden chemical change in the woman's brain can possibly trigger the mood fluctuations. As shown on the slide, common physiological signs include very low moods, feeling of inadequacy, and a failure as a mother, having a sense of hopelessness about the future, feeling anxious and panicky. In severe cases, some mothers might harbour feelings of resentment towards their child, which could lead thoughts of self-harm or causing harm to their partner or baby. A mother presenting with any of these symptoms should be referred immediately to an appropriate healthcare professional for further support and treatment.